And joining us now on Arizona Illustrated is Dr. Victoria Maizes, the Executive Director for the University of Arizona-based Arizona Center for Integrative Medicine, a program started by Dr. Andrew Weil. Dr. Maizes, good to see you.
Thank you.
And speaking of Dr. Weil, he was certainly in the national spotlight a couple of weeks ago, testifying before a Senate subcommittee, and they were looking at health care reform, and integrative medicine is now part of the conversation.
It's fabulous. I think there really is potential for healthcare reform in a significant way at this moment. People are speaking about prevention and health promotion, and I'm thrilled, as is Dr. Weil, that integrative medicine is part of the dialogue.
Why do you and Dr. Weil feel that it needs to be a key in any kind of American healthcare reform?
Well, I think there's many reasons, but one is that it has the potential to deliver care that is both effective and more cost effective. We have a tremendous dependence right now on pharmaceuticals as literally the main way, with the exception of surgery, that we take care of patients. And we need to move away from that into the lifestyle things that we know will prevent chronic diseases.
Pharmaceutical industry in some ways drives the dialogue about healthcare in this country, don't they?
Well, they certainly have a big influence because some of their funding helps educate physicians as to how they practice medicine, and that's become a big ethical issue recently.
Dr. Weil said we do not have a healthcare system aimed at preventing illness, but as he put it, a disease management system.
I think that's true. We spend very little on prevention. We really don't spend much time or effort teaching people how they could avoid getting many of the chronic diseases that are so common: diabetes, high blood pressure, heart disease. Most of these are preventable through healthy lifestyle.
As far as training integrative medicine, physicians, this movement that has started right here at the University of Arizona is now in medical schools across the country, correct?
Yes, and we're very proud. Many of our graduates are leading programs at Johns Hopkins, at UCSF, at the University of Michigan. Many other places around the United States have University of Arizona graduates at the helm.
As we have talked about many times in our conversations, we talk about diet and lifestyle change. When it comes to diet, where is a good starting point for someone that really wants to not necessarily worry about losing weight, but eating healthy?
Yes.
Maybe some targeted foods.
Yes. Well, it's interesting because we should really all know this, but it can be very confusing. There's so much mixed advertising that we're exposed to, and sometimes there are heart-healthy labels on things where we think, that's healthy? So whole foods, as much as possible avoiding processed and refined foods, things that your grandmother would recognize. Michael Pollan, who wrote The Omnivore's Dilemma, has a great line. He says 7 words, and that should be: eat food, not too much, mostly plants. So that's a guide.
That's very good advice. At the top of the program, as you know, we had a report on colorectal cancer and prevention there. Interesting study out of the United Kingdom, the results published in the American Journal of Clinical Nutrition, suggesting that a vegetarian diet may help protect against cancer.
Yes, and this is consistent, of course, with the great value we know is in fruits and vegetables, the fiber, the phytonutrients, and we always recommend that part of a healthy diet is a lot of vegetable and fruits.
That goes back to what you said about things that grow.
Yes.
Can be good for you. Now,
yes.
But surprisingly, and I don't think the researchers had an answer for this, they did find in that study a higher rate of colorectal cancer.
Yes, that was really quite surprising, and certainly I would continue to recommend that people eat vegetables and fruits. I think where the research is going that will be really fascinating is we will start to understand which vegetables, which fruits for prevention of what kind of cancer. What can we recommend if someone's already had the diagnosis to prevent a recurrence? And our sophistication and the specificity of the advice is really growing.
And in the remaining 30 seconds, and I think the confusing part would be because among vegetarians, they believe that eating red meat can be bad for you, and there may be a link to colon cancer.
Yes, and in general, we think red meat and processed meats are potentially stimulators of colon cancer, but there too the data has been mixed.
Okay, the jury is still out,
yes.
I guess. And Dr. Maizes, good to see you. We'll see you next month.
Thank you.